The apical view sections the heart from its base to its apex in a right-left view, through the obtuse and acute margins of the left and right ventricles respectively, as well as its corresponding atriums. We can see the left atrium from its upper inferior dimension, as well as the opening of the left superior pulmonary vein and the left inferior pulmonary vein. The inferior vena cava ends up in the right atrium. We can see the anterior and posterior leaflet of the mitral valve. Inserted on them, we can see the tendinous cords. We can easily notice 3 of the sigmoid leaflets from the aortic valve. We can also see the interventricular septum on its basal and apical dimension. The left and right ventricles and the posterior papillary muscles can also be seen. On the left ventricle there are 2 papillary muscles, and on the right ventricle there are 3, although less developed than the ones on the left ventricle. The papillary muscles, due to their relative parallel arrangement aligned to the ventricular wall, and their insertion with the cords of the leaflets, pull these leaflets downwards and from the centre, causing a strong coadaptation of the leaflets and preventing the regurgitation of blood during systole. The tendinous cords in the right ventricle are mainly inserted in the tricuspid leaflets, and some of them are inserted in the interventricular septum on the free wall. The valvular view represents the section of the heart from an axial view, perpendicular to its long axis, at the level of the so-called fibrous trigone of the heart. This view offers a more detailed image of the connective tissue frame, which is the fibrous skeleton of the heart, that functions as a firm point of attachment for atriums, ventricles, and cardiac valves. The central fibrous body is located in the center, and it extends itself to the medial part of the mitral, tricuspid, and aortic valves. Extensions of this fibrous body surround the cardiac valves and form the corresponding valvular ring, where the leaflets and the ventricle and atrium musculature are inserted. The heart has 4 valves, 2 semilunar and 2 atrioventricular valves. The semilunar pulmonary and aortic valves are formed by a trileaflet with the shape of a swallow's nest. The saccular part is known as sinus of Valsalva. The mitral valve is formed by 2 leaflets, the anterior and the posterior leaflet. The leaflets are connected one with the other in a series of junctions called orifices, which get fused together in a characteristic way in certain pathologies such as the rheumatic valve disease. The tricuspid valve is formed by a trileaflet, the septal, the anterior, and the posterior leaflet. The parasternal view is obtained by sectioning the heart in an anterolateral direction, starting from the base towards the apex. We can see the right coronary leaflet and the non-coronary leaflet of the aortic valve, as well as the ascending aorta. From the mitral valve we can see both the anterior and the posterior leaflet. The section allows a visualization of the cavity of the left atrium and the posterior free wall of the left ventricle, as well as its outflow tract. The anterior interventricular septum can also be seen.